Lacey Nobles, the Communications and Marketing Manager for the City of Lubbock. I want to thank you for attending tonight. We called you here to give you updates on the confirmed coronavirus cases here in the community and measures taken by the city and its partners. After our speakers, we will open it up for questions from media members. First, we will hand it over to Lubbock Mayor Dan Pope.
Thank you, Lacey. Thank you for being here this evening. It's getting to be a regular kind of thing. I want to start by thanking our partners for being here tonight. We're once again joined by Covenant in UMC, leadership from there, also all three of our local school superintendents, our largest school districts. We're thankful for that. We've got representatives from Senator Cornyn, Senator Cruz, Representative Arrington, and our local Senator Perry here tonight. We're thankful for that. County Judge is here. Thank you for being here, Judge Parrish. Things continue to evolve, and I'm going to start by, before we update you on the cases that we announced last night, I'm going to give you an update on some changes that I'm making. I continue to consult and collaborate with our local professionals, particularly the Public Health Authority, Dr. Ron Cook, our health department, led by Catherine Wells, and other experts. Also, I adhere to this, listening to what the state and the feds have to say. In the very same breath, I should mention that we continue to be open to our business community and what they have to say. They're represented here tonight. Norma's here from the chamber, our not-for-profits, and our certainly the education community, both K through 12 and higher education. Our situation has evolved since Monday. We now have 2 confirmed travel-related COVID-19 cases in Lubbock, and as you know, we reported those cases last night. We're going to talk about those in a little bit more detail momentarily. My commitment remains the same. We're going to take prudent, reasonable, and appropriate action to promote the health and safety of our community. That's job one for us. So accordingly tonight, I'm issuing an updated disaster declaration for the City of Lubbock. Here are the highlights of that. We've just distributed that. Mass gatherings are now limited to 50 people in our city. The exceptions are significantly limited as compared to the first order. Specifically, exemptions for places of worship, weddings, funerals, and museums are removed. These gatherings will be limited to 50 people. Additionally, more specific language has been added to clarify that outdoor markets are outdoor food markets. They're farmers markets, that type thing. We've added household necessities to the description of grocery stores and other establishments primarily selling foodstuffs. We've also added an exemption for homeless shelters due to lowering that number from 200 to 50. We impact our homeless shelters and we do that. We're culling them outside of this. Please note that the 50-person limit does not include employees of that establishment. So if your restaurant had 10 employees, you could still have 50 patrons. These rules go into effect tomorrow at 5 p.m. I'm issuing this declaration under the authority that's vested in me as mayor. Accordingly, this is subject to review and hopefully ratification by the City Council within 7 days. We'll do that next Tuesday evening at our regularly scheduled meeting. You may recall that on Monday, that order was set for a period until April 14th. I will ask the council to consider adding these provisions to that very same order, or updating that order. I will close by saying this. I just walked downstairs from a phone call with the governor's office, with the governor, really not the governor's office. This continues to be a rapidly evolving situation, and we will continue to make the decisions that we think are very best for all of our citizens. Thank you. I'd now like to introduce Catherine Wells, the Director of the Lubbock Health Department, for an update on the two, I should say on the coronavirus in general, the two cases that we reported last night. Ms. Wells.
Thank you, Mayor. Good evening, everybody. When we met yesterday evening, I said that our staff still needed to go back and work on the contact investigation process for the two cases that were notified, that we notified you about last night. I also want to inform all of you that as I was walking in here today, I was notified of a third case that looks like it is probably a travel-related case. However, that literally found out about that 5 minutes ago. So staff will begin working on that and doing that contact investigation. So for yesterday I talked about two different cases. The first one was a resident of Lubbock County, and through our investigation we identified that this is a student at Texas Tech University, and the student had been returning from a trip from Europe. The student developed symptoms and was tested at UMC on Monday. For students returning from abroad, Texas Tech University has arranged transportation and a place for them to stay. This was done to enable those students to be compliant with the 14-day isolation advisory that was put out by our federal government. Based on our investigation, we found out that the student did not return to that the place that was provided, and that the student went back to their home. Because of that, we will be placing everybody in that household under quarantine, and quarantine is a legal restriction that keeps those individuals from traveling out in the community. The family members will be monitored by the health department for signs and symptoms of coronavirus, and this will be in effect for at least 14 days. And if any other symptoms develop with people in that household, that order can be extended. During the investigation, the student also reported developing symptoms while traveling to Lubbock and also while visiting a local restaurant. Although the risk is minimal, out of an abundance of caution, we are going to list the times, or we have listed the times that there was visit at both our international airport and at a Rose's Cafe. So we're asking if the public were at either of these locations and they develop cough, shortness of breath, and or a fever through March 29th, 2020, so that's 14-day incubation period, that they are to contact the City of Lubbock Health Department. And those places are the Lubbock Preston Smith International Airport between 8:45 and 9:15 on March 15th. And then Rose's Cafe at 4th and Quaker from 9:30 until close, which is 11 o'clock p.m. And that's our update for the Lubbock County case. We've also worked on our investigation for the Hockley County case. The Hockley County case traveled to a state where there was community transmission, so they traveled within the United States, picked it up in a state that has ongoing transmission. The individual was seen at Grace Clinic, Covenant Emergency Department, and UMC. The patient is currently hospitalized. The medical facilities will conduct their own investigation. They have their own infection control personnel, and they will be determining that proper protective equipment was used by both the providers and the patients, and if there is anybody at risk, they will do their own contact notifications. The individual did not visit any public places while traveling between their home and the clinics. And then that traveler, or the individuals in that traveler's household will be followed by the Texas Department of State Health Services. Hockley County is under the jurisdiction of the City of Lubbock Health Department, and that falls to the State Health Department, and they will do that monitoring. And that's all I have for an update on those two cases. And then at our next press conference, I'll provide some additional information on the third case that was just announced. Thank you.
Thank you for that report, Ms. Wells. So at any given time, soon, maybe one of you in this audience, or maybe more of you in this audience, might be placed under isolation. That's the fact of what may come. Let's hope it doesn't come to that. But at some point, you may be put on isolation. What does isolation mean? It doesn't mean you have to always stay in your house, in your bedroom. What it really means is you must stay away from people. So you can imagine staying at home is going to give you the doldrums. I'm tired of looking at my walls. Spring is on us, right? The trees are blooming. Just as I was walking across the street at the Health Sciences Center to come here, I think I could smell Spanish broom blooming. I could smell cut grass from the maintenance guys mowing the yards out there. So get outside. It doesn't mean you need to stay in the home. It means you need to stay away from people. We have beautiful parks in this city. We have beautiful sunrises and sunsets. We have great wind most of the time. We have beautiful thunderstorms that I think are about to hit us soon. So it's okay to be outside, but it's got to be away from people. We don't want to quarantine people where we make you stay in your residence, okay? So that goes along with social distancing. You got to stay away from people. And like I said, get outside and go to the park. We got to wash our hands, wash your hands, wash your hands, cover your cough. If you're ill, though, stay at home, stay away from people. And please, pay attention to our special populations that need our care, your next door neighbor that may not be able to get out to the grocery store. We've all heard the term spare a square, you know, apparently toilet paper's on a rush. So let's share with our neighbors. And then the last thing I need to do is retract a statement that I've said the last couple of times about the use of NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen, Advil, Aleve. Those drugs are probably not very good for this particular virus. There's some early studies out from France and other places that say perhaps these drugs are not good. We always kind of recommend, providers recommend for aches and pains and fevers to give Tylenol, or acetaminophen, I should say, and those NSAIDs. Let's stay away from the NSAIDs, primarily because just in general, NSAIDs are tough on the kidneys, especially if you're dehydrated. And if you're feeling ill, you're not taking in a lot of fluids, NSAIDs can be rough on the kidneys. So let me retract that statement. Let's stick with Tylenol or acetaminophen for now. We are diligently working to try to keep our city and county safe and free of disease. And that's the proclamation by the mayor today. That's this social isolation that we've made. And finally, just it's our job to keep you healthy as the health department, as all the providers in Lubbock. And I know that UMC and the Heart Hospital and Covenant and all the other healthcare providers in this town want you to be healthy, not to be ill, want you to be healthy. There's an old physician named A.T. Still that says, it is harder to find health than it is to disease. Let's do our best to try to prevent disease, try to prevent the spread of this. We're here for you. We're here to answer your questions as best we can. That's all I have. Thank you. Dr. Scoville. Thank you.
Good evening. Texas Tech University had over 100 students who were studying abroad this semester. We made the decision last week to return those students back to home. As you've learned today, it's come to our attention that one of our students who was evacuated from Europe has tested positive for COVID-19 and is currently in isolation. A sentiment that has been expressed here by the mayor, by Dr. Cook, by Ms. Wells, is that the health and safety of our students, faculty, and staff in this community is our top priority. That's why we made a decision to bring all of our students studying abroad back home, hoping to reduce their risks of exposure to COVID-19 and providing them access to our healthcare system and more immediate access to the university's network of resources. Based on CDC guidance, we have very strict protocols in place for each student regarding their transportation and accommodations upon returning home. Here in Lubbock, we provided a car for each student landing at the airport, as well as off-campus accommodations that would provide for a 2-week period of isolation. After parking at the off-campus site, we made arrangements for each car to be cleaned before being returned. Wellness checks for all students who returned home began the day after their arrival by telephone and emails. We have emphasized to the Texas Tech community that we must all rigorously follow the advice of medical experts. I want to acknowledge the extraordinary efforts and support of so many, those from the Texas Tech University community, those from the Texas Tech system, and the City of Lubbock. And again, I would emphasize that the health and safety of our students, faculty, and employees is our top priority. We feel the same obligation to the City of Lubbock and our surrounding community.
So standing here listening to the mayor and Dr. Cook as well as Dr. Skubanek, what you've heard about are all the things that we have done and all the decisions that have been made to move us forward as a community. And somebody asked me yesterday, well, what's your greatest fear with all this? Well, the greatest fear I think that everybody has is that we might get something wrong. Because let me tell you how you're making these decisions. You're making these decisions based on limited information that is constantly changing. And the analogy is like if you have in a football game a quarterback that is trying to complete a pass. If he throws the ball at where the receiver is, he'll never complete a pass at all. He's got to throw the ball where the receiver is going to be. So what we're trying to do with very limited information is predict what tomorrow's going to look like, or the next day, or the next day. And that's really tough, because the fact of the matter is, I'm not just a doctor, I'm not just a chancellor, I'm a father, I'm a husband, I'm a neighbor, I'm a friend, we all are. So a perfect example of this, of making decisions with limited information, Dr. Skubanek was talking about this. Last Thursday, when President Trump announced the European travel ban, as Lawrence mentioned, we had over 100 students that were around the globe. At the time, the vast majority of those students were in Spain. And Spain was a low-risk country. So there was a debate we were having. Do we tell the students to come home? Do we insist that they come home and pay for their way to get them home? Or do we tell them to hunker down? Because after all, Spain's a low-risk country. Right next door is Italy, that was a high-risk country. So do we have them go through international airports and do all these things? Well, we made the decision that if they were our children, we would want them home. Within 24 hours of implementing that decision, Spain went from a low-risk to a high-risk country. That was the right call. But what about the next one? And what about the next one? We're going to continue to do this in a way where we will have the best decision we can have at the moment, and we will do our best to make the best decision we can. Here's the great thing about a pandemic like this. We have a lot more control over this than we think we do. We just have not been exercising that control. Jerome Adams, the Surgeon General of the United States, made a statement just a few days ago, and he's spot on about this. We as a population in the United States can decide right now, do we want to go the way of South Korea, or do we want to go the way of Italy? If we ignore social distancing, if we look at leaving school as just a snow day that means we can go hang out with our friends and go to the mall and do this and do that, we are going to go the way of Italy. On the other hand, if for the next several weeks we make the decision as a community that we're going to take this thing seriously, we'll whip it. And we won't have to overrun our health systems. We won't overrun the Heart Hospital and UMC and Covenant with people that are just flooding in. We will spare the beds we have for the people that will really need it. People will say, and you've heard this already, well, I'm young, I'm healthy, even if I get it, it's not that big a deal. You know what? It is that big a deal. Because when you're barely symptomatic and you're hanging out at the mall or some other place and you happen to walk past somebody or sit on a bench that when you get up, someone else's grandmother sits in that bench, you've created a problem. Doing this is not to protect the healthy among us. It's to protect the vulnerable. Because we don't know around us who those folks are, we all have got to act with common sense. This too shall pass. We can decide whether it's going to pass quickly or whether we're going to make this thing linger. You've got great people up here, great people. We have everybody in the community that's pulling together to make this thing happen. I implore all the adults here. This is an adult decision, and it needs to be made by the adults. If we hang in there for a short period of time, we can nip this thing. We need to stay calm. Nobody needs to get panicky, but we need to get resolved. So we're here as a community. We'll support whatever the mayor wants us to do. Thanks for having us.
We're going to open up for questions from media members that may have any.
Mayor Pope, so how far are you willing to go to make sure that people follow these recommendations to stay at home? I mean, we've heard in Italy 35,000 people have been fined for getting out and crossing the street. How far can you go? Even court orders? What are you considering?
We first and foremost hope that people don't require court orders to do this. Now, the quarantine effort is a little different kind of thing. We could handle that differently. We will have quarantine orders issued on that one residence. If we have a problem with our public gatherings, we'll deal with those on a case-by-case basis. We have the ability to do that. We have the ability to fine. That's something that we can do, and we will not hesitate to do that to ensure the safety of our community.
So there could be fines if people have gatherings more than 50?
Sure, there could be.
And
But we're not just talking about this. We're very serious about it.
And the quarantines, when people are asked to quarantine, if they do not, like the tech student, there could be what?
The public health code, the state public health code allows for consequences there, and we'll be equally as serious, if not more so, about that.
My question is to Christy Martinez Garcia from Latino Lubbock Magazine, and my question is, what was the age of the Hockley County person? Also, on the third case that we have, do we know their age? And what process is being done with the restaurant that was exposed? Are they cleaning it? What is being done at the airport as far as sterilizing these facilities?
The Hockley County case was an older individual, and that's about as much, that's the only information we can give at this time, just for their privacy. As far as the restaurant, I've been in contact with the restaurant, and they're taking this very seriously. The exposure was very in the evening, which puts less risk to the community, because going through their typical closing practices and cleaning the restaurant would limit the risk of the virus, but they have also informed me that they are going through an additional cleaning process this evening.
Is the restaurant closed? Because I know that on the surfaces that this does linger for 2 to 3 days, especially plastic and hard surfaces.
This was the restaurant's choice to be prudent and work to do an extra cleaning this evening, but they go through their normal cleaning processes, and that cleaning in the evening should have gotten rid of those germs.
But so they're still open, they've just done a thorough cleaning?
No, they were only notified today.
Okay.
So the plan that I received was that they were doing a thorough cleaning today,
Okay.
as soon as the notification happened. The airport has added additional disinfection and additional cleaning processes, and that is happening every night.
Catherine, my question's for you as well. Sarah Snuff-Walberg from the Lubbock Avalanche Journal. Will testing requirements and availability change?
Testing is increasing every day, every week. There are still requirements both to get testing done through the public health system, and those same requirements are in place if you're going through a private laboratory. All of this laboratory testing was approved by the FDA with an emergency declaration, which means that individuals have to meet those signs and symptoms in order to get tested.
And then kind of going off of that, do we know why the Hockley County patient went to 3 different facilities?
I cannot speak to that.
Let me add that we expect tomorrow to have a press conference with Covenant and UMC where they will, I believe, really respond to the community and to maybe some testing questions, but also just better clarify how they're serving the community and try to really educate our folks on the best way to reach out to your healthcare providers.
Thank you, Mayor. Okay. Hi, Blair Sable from Fox 34 News. My question is for Catherine Wells again. Sorry to make you stand up there.
Getting used to it.
So my question just has to do with the fact that this is a rapidly developing case. We're learning more and more every day, every hour. So we first learned about these cases last night, but we're learning more information now, almost not 24 hours, but a decent bit after, and there have been possible exposure sites. Do we see a problem with a delay in letting people know that they might have possibly been exposed, especially since it does last on surfaces for days?
We are working as fast as we can on these investigations. We have increased the number of staffing. I have closed our other clinics in order to have every health department nurse is working on these investigations. I believe our turnaround time is as fast as other communities are getting that information out. And I'm trying to be open and give that information as soon as it is available. And the city's also adding additional resources. We have firefighters helping answer phones so that the nursing staff can pay attention and really focus on those investigations. I have people handling my press conferences, any interviews. So we've really had the full backing of the city. There's a whole group behind me that's getting all of this work done.
And when do you expect that we can find out about this third case?
I literally found out about it while walking in the door. I have notified my staff, and they have begun doing that investigation process.
But I think you should expect a similar kind of response as we did today. Tomorrow at some point would be our goal for that.
Okay, and then
As soon as we have the information, you're going to have it, but we're not going to give it to you if it's half-baked. We want to make sure when we deliver it, you've got the right information, and we have to do our investigation to be able to ensure that it's presented in that way.
okay. And I just have one more question. This is for Texas Tech. So you said that most of the students who were studying abroad was in Spain. Do we know if the student was in Spain or another country?
We have not revealed which country this student came from.
Do you expect to reveal that at any time, or?
I would defer to Catherine Wells, who's actually doing the investigation of this matter, as to what we can say.
With all of these investigations, there's the balance of what the community needs to know and then also these individuals' privacy. So we are not going to be revealing which country. It's the same virus that's passing around all of Europe, and that's the most detail that we will give.
This is going to be the last question.
My question is, I mean, you guys went above and beyond to make sure that these students were provided with a car and that they did a 14-day isolation. Do we know of any other students that have not followed the protocol?
So, Christy, we provided a car, but in some instances, students may have had a vehicle there. And many of these students did not come back to Lubbock. So it would be, I couldn't say with certainty of what cases might have occurred where the protocols weren't completely followed.
But they were asked to do a 14-day isolation, no
Yes.
matter where they went, so other cities could also be
That
exposed.
information was conveyed in an email early on. There was a second email that emphasized you must self-isolate. We also provided a form to those students. That form came from the Texas Department of State Health Services, asking them to enter a log that informed us of what they were doing.
Okay, thank you.
Let me speak a little bit about the notification process. So anytime there is a case in Texas, local health departments are in charge of that area. So if there was a student that was in another area, then that health department would be notified and be handling those investigations.
Yes.
Can you explain travel? I mean, originally we thought the sentiment of travel would be like a travel abroad, but now does that mean somebody goes to Dallas or Houston?
So the CDC hasn't set up any guidelines yet except for foreign travel, return from those level 3 countries. But we don't have any restrictions. We're not putting restrictions on people. So if they went to Disneyland or they went to Seattle, we would still ask them to self-isolate, but not quarantine them. And so self-isolation requires, there's a log, you take your temperature twice a day, and you report your symptoms on a form twice a day, so we can monitor those symptoms. And then we have people that check in with them, and then they call us and say, oh, I'm not feeling too good. So that's really, if you go to Seattle, I'm going to ask, and you come back and tell me, I'm going to ask you to self-isolate. Anybody that's traveled to those areas that we know are high risk. Let me emphasize, if you have plans to go someplace that's already had outbreaks, I would just say no travel. I just had a friend postpone her wedding by 6 months. She said, I'm not going to have my wedding. She's not in Lubbock. And she said, what should I do? And I said, I wouldn't do it because she's going to have a big wedding, correct? So she has chosen to postpone her wedding. That's a very important day in somebody's life, right? But she chose not to do that, and that's the right decision. We shouldn't be going places at this moment in time. That's hard. Maybe 3 months, and let's see where things go. 3 months out of your life of 80 years is not very much. So let's make the right decision.
Okay, that concludes our news conference. We will have more information as it becomes available. In the meantime, please look to the city's official social media pages for the latest information and the websites.